The ongoing power cuts continue to cripple operations at health facilities, with the Health Minister, Dr. Joe Phaahla, recently revealing that hospitals had spent almost 700 million rand on diesel to keep generators going between April 2022 and February of this year. Under the state of disaster, some public hospitals were exempted from load shedding. And now that the state of disaster has been lifted, well, where to from here? We're joined by Philip van Staden of the Freedom Front Plus. He's the spokesperson for health in the party. Thank you very much for your time this afternoon, Philip. As we continue to count the cost of load shedding, you believe this is wasteful spending or irregular spending, though?
Yeah, you must understand that the Department of Health in South Africa is under severe strain, and with a budget of only 60.1 billion for the 23-24 financial year and for only 64.6 billion in 22-23, we can foresee a dark picture which is coming forward, the winter months which is coming forward in this country. So we foresee a big problem is on the horizon if the winter is with us, and that probably this amount in this new financial year will escalate. And that's a big problem for us. We currently know what the status of our infrastructure is in South Africa. Our infrastructure has totally collapsed, and therefore we have now these problems that we see now, that load shedding is as it the order of the day. You must remember also that the SA Reserve Bank stated that if a stage 6 load shedding is running through South Africa, it's costing the country 900 million rand a day. Now, if we look at these figures from the Minister in his answer to me last week, where an amount of 685 million is spent on diesel for generators at state hospitals, and if you break it down, it can come down to an amount of 1.8 million rand a day. Now, we say as Freedom Front Plus, with this severe constraints on the health budget, it will lead to utter chaos in the health industry, public health industry, as it already has done. And we've foreseen a dark picture in this coming winter.
What's the alternative, Philip?
That's a problem. Is there an alternative? The Minister also answered me in a question in February this year, but they're looking at solar systems at the 3,800 public clinics across the country. Now, we must ask the question if that will solve the problem. We know that the solar system is a very high-cost system, and will the budget of the health department be able to afford that? I don't think it will be. I think the situation will only be worse. So that's the problem we're having in this country. That will not solve the problem. I think what must be done, but plans must be made and drawn up to enable the public healthcare sector to overcome this current power crisis. We must also remember that the problem is not with only the public health system, but in the private health system as well. We sit with a total of 203 private hospitals and 610 private clinics. So overall, we have plus minus 5,000 health facilities across South Africa, which is rendering under this problem. So adequate plans need to be made urgently, and we must take into consideration that the load shedding is not a new problem. It came with this country since 2008. So why not was we not plans made earlier to solve this issue and try to solve this problem?
So according to the Minister of Health, KwaZulu-Natal spent the most in terms of getting diesel, with the sum there being some 178 million rand, Gauteng 131 million rand, and the Western Cape 102 million rand. The Free State, though, recording the lowest amount spent, 21 million rand. Do we know why certain provinces are doing marginally better than others? Is it because of the population? What are some of the reasons behind that?
I think the population figure could be the result of this. It's unfortunately not clear at this stage. We must still require that question to the Minister and to see what the answer is coming back. But we must understand that Gauteng has a huge population. I think the population in Gauteng is now standing at 16 million people. KwaZulu-Natal has got a huge population, and the Western Cape, this population is growing with people emerging to the Western Cape from certain provinces. So I think it will be the factor at the end of the day, yes.
Yeah. Thank you so much, Philip, for your time this afternoon. Philip van Staden is with the Freedom Front Plus. He's the spokesperson on health for the party.